Hi, Dr. Applin here, and today I would like to talk about shoulder pain, most specifically rotator cuff injuries. And first, we need to define what the rotator cuff is. Rotator cuff is responsible for external or outward rotation of your shoulder joint. It's comprised of four different muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis muscles. And injury or irritation to one or all of these muscles can cause rotator cuff pain. Some typical symptoms of rotator cuff injury is pain, especially with overhead activities in the shoulder. Most common methods of injury are either direct trauma, like say a fall on an outstretched arm. If you fall like this, you're very prone to injuring your rotator cuff, or repetitive stress injuries. Repetitive stress injuries are usually due to activities that require the same shoulder motion over and over and over again. Some examples might be tennis, baseball, swimming, someone who cleans around the house a lot, even just that overhead motion of wiping down a mirror or cupboard. So many different ways to injure the rotator cuff because the shoulder is such a movable joint. So when it comes to rehabilitation of the shoulder pain or rotator cuff injury, we're really going to have four different goals. First is going to be to reduce the sore points in the muscles, and we do that through massage. Second thing is going to be to improve the flexibility of the shoulder, which we do that through specific stretches. Third thing is to make sure that the mobility in the shoulder joint is as well as it should be. We do that through mobilization procedures. And last and most important point is specific rehabilitative exercises for the rotator cuff and shoulder joint as a whole. We really want that shoulder nice and secure in its joint there. Because the shoulder is the most movable joint in the entire body, it's actually very unstable and is held in place primarily through muscles, tendons, and very few ligaments there. So because of that, the strengthening routine is an even more important part of the rehabilitation of the rotator cuff. So go ahead and read through the article. I think there's a lot of good information in there. And if you're suffering from shoulder pain or specifically a rotator cuff injury, then go ahead and give us a call. Thank you.